Well, it's my great privilege to speak briefly in honor of Dr. Ted Stanley, who was the senior statesman for our department at the University of Utah over many decades. Ted was a remarkable man. I want to just tell you a little bit about his life and about his impact in anesthesiology. Ted was born in Brooklyn, New York, to a middle-class family and lived a quintessential American childhood. His youth was devoted to refining his music and baseball skills. He was quite a musician and loved baseball. He graduated as the valedictorian of his high school class and was admitted to Columbia University, where he pitched on the baseball team and was what we call a walk-on, a non-scholarship player on the football team. It became clear to him after some time that his childhood dream of playing for the Brooklyn Dodgers, now the Los Angeles Dodgers, was not going to materialize. And so he decided medicine was a reasonable alternative. He completed his medical studies at Columbia, and it was at this juncture that he made the move west. He studied at the University of Michigan for a time, studying surgery, and then ultimately relocated as a young doctor to the University of Utah, where he spent his entire career. These are some pictures of Ted through the years as a young man on the left, and then as sort of a mid-career doctor on the right. He was a handsome, charismatic, charming person, and was the spotlight of any gathering. His impact in anesthesiology was far-reaching and substantial. These are some stats from the Scopus database that represent a reflection of Ted's impact. Over 200 publications, over 5,000 citations in the medical literature, and H-index of 40. Ted had an indelible mark on the clinical science of anesthesiology. He's most widely known, as represented in publications like this, in Anesthesia and Analgesia, the official journal of our society. He's most widely known for his introduction and a study of the role of opioids in anesthesia practice, particularly as it related to cardiac anesthesia practice, leveraging a long-standing relationship with Dr. Paul Janssen in Belgium. He was instrumental in the development and introduction of the fentanyl family of opioids into anesthesia practice, and many refer to Ted as one of the fathers of fentanyl. He also exerted a lot of creative genius and energy in entrepreneurial research and activities, and was the founder of a number of biotech companies. Chief among them was Anesta, which developed the transmucosal fentanyl delivery system, which was a very popular method for treating breakthrough pain, particularly in the cancer pain population. The success of Anesta as a spin-off company of the University of Utah's Department of Anesthesiology created a substantial royalty stream that funded a large endowment that we now use to support research within the department. Ted was such a noted figure in medicine and anesthesiology that he had obituaries done in both the New York Times and the Washington Post. And you can easily find links to these and read them. They're quite amusing and fun to read because they capture some of the zeitgeist of Ted's life. At the University of Utah, we have also honored Ted. We convene a research symposium honoring Ted called the Theodore H. Stanley Research Symposium, and we have an endowed chair named after Ted that also has an accompanying research fund that is intended to extend his legacy in perpetuity. I want to end by showing you a quick video of Ted. This will capture his personality a little bit, and I think you'll get a kick out of seeing it.
The most important thing I believe in life is having fun in whatever you're doing it responsibly, but having fun. I've been a professor of anesthesiology for the last 40 years, and for the last 25 to 30 have been an entrepreneur. What has ruled my life is trying to enjoy what I'm doing and see potential avenues to the future which are even more fun and more possibly productive than what I'm doing. So that in this state, in this university, can happen. Well, the most successful of my ideas was what was called the fentanyl lollipop, ultimately called Actique, something that patients could suck on and allowed a very potent morphine-like substance to rapidly enter their bloodstream through the mucosa, or the lining of the mouth. Actic was useful because it was small, it was non-threatening. The beauty of that technology was that the patient could use the handle to take the lollipop out when he or she achieved pain relief. So many people have had the opportunity to say, you know, I think I can do it a better way, and the people who run this institution have stimulated that and supported it, and as a result, this attitude, this wonderful feeling has existed and allowed people like myself to take advantage of it, and sometimes we're lucky and it actually works out as good as, or maybe better than we hoped it might.